Hi, Dr. Nelson here. I am a clinician in private practice in Rockford, Illinois and Crystal Lake, Illinois, and I'm also an associate professor at Judson University where I teach graduate counseling students how to be effective in the field. My practice is at www.counselingtransforms.com if you want to know more about us. Today's topic is gambling, a little bit of background. There are two main types of gambling: continuous, that has a shorter time frame. It's about instant gratification. The most common, or one that you're probably familiar with, is electronic gaming machines. I know, for example, in Illinois, where we have the practice, gaming machines are popping up everywhere, gas stations, basically everywhere. Another form is non-continuous, that has a longer time frame. The most common form of non-continuous gambling that you're probably familiar with is lotteries. Interestingly enough, electronic gaming machines are the most addictive according to the research literature. The onset of the problem with gambling is very quick, and the most common modality in problem gamblers is the psychological component and the environmental component when it comes to electronic gaming machines. So, if you've been around electronic gaming machines, they have a video game feel. There's sounds and lights and things to draw your attention. And so the whole environment is set up basically to draw someone in and keep them longer, including things like, if you go, most places where you go to use electronic gaming machines, there'll be a lack of windows. Oftentimes they serve alcoholic beverages and things like that. So you have a tendency to lose track of time and probably spend more money before you leave. The other part of it is the psychological factors of the gaming machine, because it really does play into that. It's set up again to draw us in and keep us there. And so there's psychological factors or issues that we'll look a little bit more at later. Co-occurring considerations. Understanding the functional relationship between problem gambling and any comorbidity is critical for effective treatment. What that means is sometimes, and probably oftentimes, there are other issues in someone's life in addition to the problem gambling. So let's say anxiety, depression, substance use, those kinds of things. And we need to identify those in order to successfully treat the whole. Otherwise, one thing tends to interfere with the treatment of the other thing. For example, problem gamblers are 9.1 times more likely to have a personality disorder, 7.2 times more likely to have nicotine dependence, 6.3 times more likely to have a problem with alcohol, 5.4 times more likely to use drugs, 3.4 times more likely to have an anxiety disorder, and 3 times more likely to suffer from major depressive disorder. Some other, the major players when it comes to co-occurring issues are nicotine dependence. About 60.1% of problem gamblers are dependent on nicotine. 57.5% are likely to have another substance use disorder, so that would be alcohol or other drugs. 37.9% are more likely to have a mood disorder, and 37.5% are more likely to have an anxiety disorder. Gender also plays a role when it comes to gambling addiction. So males, just being male is a risk factor. Males tend to have a kind of a genetic predisposition that's passed down, so higher heritability rates, and 2/3 to 3/4 of pathological gamblers are male. Interestingly, men tend to gamble because they like the action, so they like gambling that's about action and games of skill. In contrast, females, about 24 to 48% of females could be considered moderate gamblers, whereas 27 to 53% could become problem gamblers. And women tend to gamble for different reasons than men, particularly to escape, to kind of get away from things. And they tend to prefer games of chance instead of games of skill. Age also plays a role when it comes to gambling addiction. Adolescents are 2 to 4 times more likely than an adult to have a gambling problem, and 4 to 8% of adolescents would fall in the category of pathological gamblers. Pathological basically means that things have gotten out of control to the degree that it's interfering with work, school, home, and is causing clinically significant impairment or distress. In other words, it's really getting bad. And somewhere maybe 10-15% or more could be considered at risk when it comes to gambling. Adolescence, some personality factors that can play out in this, and what's kind of fascinating is that these are normal adolescent traits that are developmental hurdles for adolescents to work through. So adolescents tend to be more impulsive. They like risk-seeking behaviors, looking for excitement, intensity, and they're less inhibited. So they tend to kind of want to put themselves out there. And these are normal things that adolescents deal with, but it also makes them more likely to get sucked into gambling and have it to become a problem in their lives. Seniors tend to gamble because of social activity. Probably the thing that might pop into mind would be like bingo, like seniors playing bingo. Of course, they play many other things, and seniors and gambling is consistent across many cultures. So, for example, Chinese culture, mahjong, or others may play dominoes and things like that. But gambling in seniors is cross-cultural. About 86% of seniors gambled in the last 12 months, according to one study. The problem gambling rate is about 2% of seniors, and the pathological, remember that's like the really high where it really gets out of control, is about half of 1%. Gambling screening and assessment, let's talk a little bit about that. Screening is where we briefly find out if there may be a problem, and then assessment is where we go into more detail. And there are a couple short screening instruments that we're going to look at, one in particular, but how that works, like if someone is going to go in to get checked out to see if they have an issue and maybe seek treatment. The first thing is a short screen, and if that comes back positive, that indicates that there's a problem with gambling. Then they move into an assessment phase. If that comes out positive, that would result in a diagnosis, and if someone gets diagnosed, then they are referred on for appropriate treatment. Screening tools, 3 that come to mind that are very brief and seem to have good reliability and validity are the brief biosocial gambling screen, the NODS clip, and the lie bet questionnaire. So the one that we're going to focus on for a moment is the lie bet questionnaire. So if you think you may have an issue with gambling, or if you have a loved one that may have an issue, these are 2 different items in the lie bet that you can ask and determine if they have a problem or not, or are likely to have a problem or not. First part of that is lie. So the question is, have you ever had to lie to people important to you about how much you gambled? So lying about it is an issue. And the second one, bet. Have you ever felt the need to bet more and more money? So if you put those 2 together and someone has a tendency to lie about their gambling, and if they bet more than they intended, then chances are they've got an issue and need to be assessed and probably treated if the assessment comes back positive as well. When it comes to assessment, the Diagnostic and Statistical Manual of Mental Disorders, currently in the 5th revision, is the gold standard. There's limited research when it comes to the diagnostic criteria because the gambling addiction thing has really been coming to the forefront in recent years, and the research hasn't quite caught up yet. But here's the criteria, just in case you, again, or a loved one has a potential issue. These are the things that we're going to look for. So this is within a 12-month period. The first thing is, does the person gamble with increasing amounts of money in order to achieve the desired excitement? Are they restless or irritable when attempting to cut down or stop gambling? Have they had repeated unsuccessful efforts to control, cut back, or stop gambling? Are they preoccupied with gambling? Do they often gamble when they feel distressed? In other words, to kind of self-medicate their mood or what's going on emotionally? After losing money gambling, do they return another day to quote-unquote get even? Do they lie to conceal the extent of involvement with gambling? Do they jeopardize, or perhaps have they lost a significant relationship, job, or education or career opportunity because of gambling? And do they rely on others to provide money to relieve desperate financial situations caused by gambling? Finally, the gambling behavior is not better explained by a manic episode, and that's beyond the scope of what we're talking about today. But the more of these that someone would check yes to, the more likely they are to have a problem. And in fact, if you look at the bottom of the screen there, the severity, if someone has 4 to 5 of those, they meet the diagnostic criteria for a gambling problem. And if they have 6 to 7, then it would be considered moderate. Whereas if they have 8 to 9 of those criteria are met or checked off, then they probably have a severe gambling problem. What do we do when it comes to treatment for someone that has a gambling problem? Let's look at psychological treatment first. Cognitive behavioral therapy is one of the most researched and efficacious treatments for a variety of issues, including addiction, like chemical kind of addiction, alcohol, drugs, gambling, but it's also effective for things like anxiety and depression. And so here's the quote: there's an increasing evidence of the efficacy of CBT for problem gambling in a range of settings and in combination with other interventions. Although the literature does not provide a strong basis for differentiation of the available treatment options, cognitive behavioral therapies have been cautiously recommended as best practice for the psychological treatment of problem gambling. So what that means is, as I mentioned earlier, the research is still catching up to the problem that's becoming more prevalent, and yet cognitive behavioral therapy is considered best practice. So it has been shown to be effective, but there may be other modalities of treatment that may also be effective, and we'll find out more as the evidence builds, as more and more research progresses. The behavioral part of cognitive behavioral is that the behavior is learned. Gambling is a learned behavior. It's randomly positively reinforced by winning, and so that's kind of the catch. It's also negatively reinforced as an escape, so I can get away from emotions I don't like I'm sad or something, so I'll go gamble, and that makes me excited, and so I'm not feeling sad. Also, it's reinforced by operant conditioning, and that's the arousal, the excitement, and it's usually set up to provide that. Again, the environment is usually customized and built to facilitate these things, to kind of get somebody in there and kind of keep them in there longer and maybe even get them hooked. The cognitive part of this is we look at the invalid beliefs. For example, the irrational belief that winning is imminent, like I'm going to get it this time, I'm going to win this time, I feel lucky. Hunches, omens, and systems. So a lot of gamblers have not only hunches and omens, but they have systems. They have things that they do that they think brings them luck. So it could be a lucky hat or item of clothing or a lucky machine that they sit in front of. And I've even seen some clients that would do things like they'd rub the machine, and that's supposed to bring them luck. And so they think that luck is personal, like it's about them as opposed to the statistics or the odds. In other words, the math. And in fact, like the gaming machines are electronic, and so they're programmed how to pay out and how much. So it actually has nothing to do with luck. So there are some false assumptions as well, like not conceptualizing statistical independence and randomness of winning. And that's actually set up again to help somebody draw them back and keep them in the loop. Maintained by biased interpretations. And so what happens is a lot of times we look back and we recall the wins and we ignore the losses. So there's been research about relationships that way. Like a lot of times people look back at what was a bad relationship. They ignore the bad and they reminisce fondly about the good part. And it's the same thing with gambling. The other thing is, this is a personal kind of an anecdotal thing. I was in Las Vegas once and I was listening to the bartender talk to a patron about how the machines at the bar used to pay out a lot better, but they remodeled the bar, and so they reduced the machine payout in order to bring in more money to pay for the renovation of the bar. So nothing to do with skill, nothing to do with luck. It was actually set by the owner. The machines were programmed at what rate to pay out. Cognitive interventions for problem gambling. The independence of gameplay, in other words, again, the machines are statistically programmed to pay out at a certain rate. And even things like roulette, statistically, we know what the odds are in card games and things like that. So it's really about the statistics and the odds. It's not about luck or those kind of things that draw people in. Ineffectiveness of strategies and superstitions. a lucky jersey or something like that is really not going to change the programming in the machine or the odds at the gaming tables, and a negative statistical expectation of winning. So again, kind of skewing the actual data to suit my worldview. Like, I'm going to get it this time. I'm lucky today. Those kinds of things versus the actual math. Group therapy is one of the primary modalities for most addictions kind of treatment. It's cost effective. It normalizes the problem because other people are there that struggle with the same issue. So it kind of gets rid of the shame and the stigma because I'm talking with other people that get it. And another cool thing is when you're doing group work, there's support and group cohesion in the process can be quite powerful. It also provides a structure. Not only are most groups structured, but also typically, like for example, intensive outpatient treatment is 3 3-hour groups a week. So there's structure in somebody's weekly schedule revolving around treatment. It reduces lying and self-deception because it's hard to con a con man. So what happens is when people have the same issues and they're in group, they'll call each other out on things like when they're in denial or glorifying, gambling or whatever it is. And so they get it, and so they can speak truth in a caring way, and that's usually pretty powerful. Vicarious learning, so that's learning from others in the group. So as someone is maybe processing how, I gamble because I use that to change the mood. Like when I feel down or I feel anxious, I gamble and it's exciting and I get away from my feelings. And other people can learn not only about that reason for gambling, but also what are some better ways to deal with that. In other words, what are some coping skills that I could use instead of turning to gambling and then throwing away my paycheck. The other thing that group does is it can provide opportunities for interpersonal skills. So, like how to appropriately confront somebody else or talk about an emotional issue or those kind of things. So, group is a very powerful method of treatment for all kinds of issues. Length of interventions, brief interventions are usually 1 to 4 sessions. That's usually more appropriate as an early intervention before somebody really gets off the hook when it comes to the gambling, or there's a lesser degree of severity of the issue. And typically, brief interventions are a combination of cognitive behavioral therapy and something called motivational interviewing, which is kind of more clinical, but those are very powerful resources for helping people get better. Minimal interventions and self-help things like workbooks, maybe with booster sessions, as well as online telephone and online media resources can also help outside of sessions. There's inpatient process of treatment that's usually based on the disease model and came out of the alcohol and drug fields. Drug and alcohol and gambling may be combined into one kind of treatment, one-stop shop. It involves, usually inpatient involves individual counseling, group counseling, some psychoeducation about what happens in the brain, and as well as coping skills and strategies. Generally 12-step meetings like Gambling Anonymous or family sessions. As a side note there, a lot of times when someone has an addiction, the family recovery is also a part of that, but there's an early phase of family recovery that can be problematic. And so a lot of times when someone has an addiction, the family member are initially, they're distressed about what's going on, they're worried. And then when the person gets into treatment and is stable, then usually the family has to deal with their own anger issues because of behaviors that were related to the addiction. And the family needs help to process that appropriately so that they don't actually aren't counter-therapeutic for the person that is in treatment. And medical, legal, financial, and vocational consults because of the fallout from the problem gambling. Psychological goals would include things, or could include things like total abstinence, which is the historical goal, and that again comes out of the recovery movement, and addiction treatment like chemicals like drugs and alcohol. However, there's something that's called controlled gambling, may be appropriate for some. There is some empirical or research support for that. However, 66% of the people, according to one study, that started off with a goal of controlled gambling changed to a goal of abstinence because they set limits for themselves and couldn't maintain it. And so they realize that if they do any, it's going to get out of control. And so they shift the goal to abstinence, which means no gambling. Some other interventions: voluntary self-exclusion is one, and that's a demand reduction strategy within a harm minimization approach to gambling policy and regulation, and are associated with a reduced urge to gamble, increased perception of control, a reduction in intensity of negative consequences, and reduced gambling severity. So basically, this is when someone advises the different gaming establishments that they want to be on the list to not be allowed in. However, it is a voluntary thing, so in other words, they could take themselves off the list. In terms of voluntary self-exclusion, about 50% or more of those who do this are male. They tend to be pathological gamblers, again, where things have really gotten out of control. 45% originally intend to return to gambling, that's their hope, but they tend to break their agreements. 50% use other games, in other words, they kind of switch addictions within the gambling context. About 30% remain abstinent. Self-help groups are popular and growing for this issue because it is becoming more widespread. The self-help approach by itself does not have professional involvement, so people who are in Gambling Anonymous, for example, they are run by other people that have gambling issues, and so they're not run by professionals. They're cost effective. They tend to be time efficient. So most self-help groups, like 12-step groups, are about an hour, and they usually meet at different times of the week in different places, so they're convenient. There are such things as cognitive behavioral self-help workbooks. So for example, you could look on Amazon or other places to see what kind of self-help workbooks might be available. 12-step groups again, and there are a growing number of internet-based interventions like online support groups, as well as education materials, including the one that you're listening to today. Pharmacological interventions can be effective. The selective serotonin reuptake inhibitors are the most common, so that would be like the Zoloft class of medication. The assumption is that the problem gamblers have low serotonin levels in the brain, and so the SSRIs increase the serotonin and hence alleviate some of the problem. However, high placebo response rates, in other words, where they do blind studies and they give one person a placebo, like a sugar pill or something, instead of the SSRI, some people respond really well to the placebo, in other words, the non-medication variable. And that can kind of make the research a little confusing. But SSRIs are also well tolerated. They can have some side effects, but the SSRIs are the most common when it comes to treating gambling addiction in terms of medication. Antidepressant medication should not be used to reduce gambling severity in people with gambling problems alone. So in other words, usually there's a co-occurring anxiety or depression, and those are the folks that you would want to probably consider an antidepressant like the SSRI to work with, not just if someone has no other co-occurring issues and just is a problem gambler. The combination of psychological and pharmacological therapies can have significant advantages over monotherapies by providing additive or even synergistic effects on efficacy. Basically, what this means is that when you combine treatment like counseling and medication, that usually has kind of an exponential increase in good outcomes. So the sum is greater than the whole when you put it all together. So that's like probably the gold standard, is combining medication and counseling for maximum effect. Final thoughts about gambling. Recommendations, if you or someone you love has a problem, would be probably cognitive behavioral interventions, motivational interviewing, or also known as motivational enhancement therapies, minimal or brief practitioner delivered interventions, and self-help programs along with Gamblers Anonymous. So those are some things to look at if you or someone you care about has a problem with gambling. Cognitive behavioral therapy is best practice and has been recommended for the psychological treatment of problem gambling. So look for a therapist who specializes in cognitive behavioral therapy. Co-occurring considerations, if someone has other issues, you treat the dominant co-occurring issue. So whatever is the biggest issue, you tackle that one first. If someone has an issue with substances, particularly opioids or prescription meds, you want to tackle that, typically with medication to treat those. SSRIs, the selective serotonin reuptake inhibitors for depression or anxiety that is co-occurring with the gambling. And if someone has evidence of manic or hypomanic episodes, then lithium, because that they would probably be diagnosed as bipolar, and lithium would get the bipolar issues under control, and then you could also tackle the gambling. If you are a professional and you have found this interesting and you would like to get CEU credit for in a more extended version of this training, you can go to mylearningpoint.com, which is by NetSmart, My Learning Point, and you can sign up and buy the CEUs and the course. And once you complete that, then you would get a CEU certificate. Thanks for joining me today. I hope this was useful.